Hi and welcome to our telehealth video information series. My name is Garvin and this video is on Enstilar. So what is Enstilar and what is it used for? So Enstilar is used on the skin to treat psoriasis vulgaris in adults. Psoriasis is caused by your skin cells being produced too quickly. This causes redness, scaling and thickness of your skin. Enstilar contains Calcipotriol and betamethasone. Calcipotriol helps to bring the rate of skin cell growth back to normal, and betamethasone helps to reduce the inflammation. So the active substances, calcipotriol and betamethasone. 1 gram of cutaneous foam of Enstilar contains 50 micrograms of calcipotriol and 0.5 milligram of betamethasone. So what you need to know before you use Enstilar: do not use Enstilar if you are allergic to calcipotriol or betamethasone or any other of the ingredients of the medicine. Also, if you have problems with calcium levels in your blood. And also don't use Enstilar if you have certain types of psoriasis called erythrodermic psoriasis or pustular psoriasis. As Enstilar contains a strong steroid, do not use Enstilar on skin areas affected by skin infections caused by viruses such as cold sores or chickenpox, and skin infections caused by a fungus such as athlete's foot and ringworm, and skin infections caused by bacteria and caused by parasites such as scabies and tuberculosis and perioral dermatitis and thin skin, easily damaged veins and stretch marks. Don't use it either if you have acne, rosacea, which is severe flushing or redness of the skin on the face, or if you have ulcers, leg ulcers or wounds. So some warnings and precautions on Enstilar. Talk to your doctor, pharmacist before using Enstilar if you have diabetes, so as your blood sugar level may be affected by the steroid. Also, if you're using other medicines that contain steroids, as you may get some side effects, and you have a certain type of psoriasis called guttate psoriasis, talk to your doctor or pharmacist during treatment if you have used this medicine for a long period of time and plan to stop, as there is a risk your psoriasis will worsen or flare up when steroids are suddenly stopped. Your skin becomes infected as you may need to stop your treatment. So for children and adolescents, Enstilar is not recommended for use in children below the age of 18 years of age. So other medicines and Enstilar. So talk to your doctor, your pharmacist, if you're using, have recently used, or might use any other type of medicine before using Enstilar, especially creams and lotions. So for pregnancy and breastfeeding, if you're pregnant or breastfeeding, think that you may be pregnant or planning to have a baby, speak to your doctor for advice before using Enstilar. If your doctor agreed that you can breastfeed, take care and do not apply Enstilar to the breast area. Regarding driving and using the medicine, this medicine should not have any effect on your ability to drive or use machinery. So how do you use Enstilar? Always use the medicine exactly as your doctor has told you. And if you're unsure, check with your doctor or pharmacist. Enstilar is for cutaneous use, so that's on the skin only. Before use, read the patient information leaflet. Even if you've used Enstilar before, Enstilar is designed for direct application or spray on to your skin affected by psoriasis vulgaris. So first you shake the can for a few seconds before use. Apply the foam by holding the can at least 3 centimeters from the skin and spray directly onto each affected area. The foam can be sprayed holding the can in any orientation except horizontally. Gently rub the foam into each area affected on the skin. After applying the foam, put the cap back on the can to prevent accidental spraying when not in use. Wash your hands well after using Enstilar unless you're using the foam to treat your hands. And this will avoid accidental spreading the foam to other parts of the body, especially the face and mouth and eyes. So for the duration of treatment, apply the foam once daily. It may be more convenient to use the foam in the evening. The normal treatment period is 4 weeks, but your doctor may decide on a different treatment period. If you've used more Enstilar than you should, so it's important, one 60-gram can of Enstilar should last at least 4 days. If you use other Calcipotriol containing medicines, the total amount of Calcipotriol medicine, including Enstilar, must not exceed 15 grams per day. Contact your doctor if you've used more than the recommended dose. Excessive use of Enstilar may cause a problem with calcium in your blood, which usually returns to normal when treatment is stopped. Excessive prolonged use can also cause your adrenal glands to stop working properly. So the adrenal glands are found near the kidneys and produce hormones. So if you forget to take Enstilar, do not use a double dose to make up for a forgotten dose. Just simply leave out the missed dose. If it's within a few hours, 3 or 4 hours, you can take the dose. But if it's longer than that, wait until your next dose is due. So uncommon side effects of Enstilar would be allergic reaction, and symptoms may include skin rash and swelling of the skin, face or mouth, worsening or flare up of your psoriasis after treatment has stopped, and a rise in calcium levels in the blood, skin irritation which might include itching, burning and stinging, or redness of the skin, and redness, pain or swelling of the hair roots of the skin, and loss of skin colour. Enstilar contains betamethasone, which is a strong steroid, and calcipotriol. You may therefore experience the following side effects. These side effects are more likely to happen if Enstilar is used for a long period of time, if used under dressings or in skin folds such as the groin or armpits or under the breasts, or if it's used on large skin areas. Allergic reactions with swelling of the face and other parts of the body such as hands or feet, swelling of the mouth or throat and trouble breathing. Calcium levels in your blood or urine may increase so much that you get symptoms, signs or frequent urination, constipation, muscle weakness and confusion. When the treatment is stopped, the calcium levels return to normal and your adrenal glands may start working properly. Signs are tiredness, depression, anxiety, cloudy vision, difficulty seeing at night, sensitivity to light, and eye pain, red eye, decreased or cloudy vision, and infections because your immune system is weakened. So final safety caution. It's extremely flammable aerosol and it's a pressurized container. It may burst if heated. Protect from sunlight. Do not expose to temperatures exceeding 50 degrees Celsius and do not pierce or burn even after use. Do not spray on an open flame or other ignition source. Keep away from sparks, open flames and other ignition sources, and no smoking near the can. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact us through the website mytelehealth.info or call into us at Lynch's Pharmacy in Douglas and Cork, or you can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.